Hello and welcome to our presentation of Toothpaste Comparison Lab, a project we completed in microbiology last semester. Presenting this project today are three of the four participants, Emily Owens, Sarah Pate, and Paige Phelps. We hope you enjoy and learn a lot about the toothpastes that you're using.
In the slide, it talks about a certain video that you can click on, and it helps like how there's so many different kinds of toothpaste that are in the market now these days, especially with different like brands and different ways of you can either brighten or you can either whiten your teeth or it can fight cavities. There's specialty toothpaste, and this is just what that introduction video talks about.
Our hypothesis was that the Aquafresh toothpaste will clean the teeth and leave the least amount of bacteria on the teeth due to it having the highest concentration of sodium fluoride. Knowing that fluoride is a coating used on the outside of the teeth to prevent tooth decay, cavities, and oral bacteria growth, we decided that the toothpaste with the highest concentration of fluoride would show the best results at preventing microbial growth. The toothpastes we decided to use were Crest, Colgate, Young Living, and Aquafresh. These toothpastes are ones that each individual either used or heard positive comments about, and each of them had a different concentration percentage of sodium fluoride. Crest had a percentage of 0.243%. Colgate's percentage was 0.24%. Young Living had a concentration percentage of 0%, and Aquafresh had a percentage of 0.25%. Aquafresh, having the highest percentage of sodium fluoride involved in its makeup, as you can see by this chart, was decided by the group to be the one that was chosen to produce the best results for cleaning one's teeth.
So in the previous opening video where it talks about the many different kind of brands that there of toothpaste there is these days, it really hit on the fact of sodium fluoride is the key component of what fights cavities. So it's a medication used to prevent cavities. It makes the teeth stronger and we're more resistant to decay. So which is really important as we age too, that we always get that sodium fluoride so that our teeth don't break down. And it also is used to prevent inflammation of the gums. So like gingivitis is really like what you really don't want to happen. So that's what sodium fluoride is important for. And it is not recommended for individuals less than 6 months old. So oftentimes when you go to the dentist, you will be getting a fluoride treatment, and that is really to help the teeth become stronger and prevent cavities as well. So in the previous slide, I talked about what sodium fluoride is often used for and like what it actually is, since it is a chemical compound. So how does it actually kill the bacteria on the teeth? So bacteria in dental plaque is responsible for the acidification of plaque that results in demineralization. So it's breaking down that too. It acts on the surface of the teeth or directly affects the mineral phase of the enamel. So then sodium fluoride in result prevents the tooth decay by making the enamel more resistant to the actions of acids and bacteria. So it provides that barrier to help that teeth prevent from breaking down. Then it accelerates the buildup of healthy minerals in the enamel, which helps slow the decaying process. So especially as we age, the decaying process is always going to happen, but that sodium fluoride is trying to prevent that from also occurring at such an increased rate. So at the cellular level, sodium fluoride acts to reduce the acid tolerance of the bacteria by being a direct enzyme inhibitor or enhancing the membrane permeability to protons and compromising the function of enzymes in exporting protons when it induces acid inhibition. So it's inhibiting the acid breakdown up on that teeth is what sodium fluoride is actually doing. As previously mentioned, I talked about how sodium fluoride in result is actually a medication, and with every medication, there's always the potential of having adverse effects. And some of these adverse effects can include like rash, especially on the gum areas, itching of the teeth, swelling, especially on the tongue, face, and throat. So places where that toothpaste could possibly go. Trouble of breathing, if severe, could actually occur, and too much fluoride could actually cause pitted teeth, which is in the picture to the right. And it's important that if you do experience any of these symptoms, either talk with your dentist or your healthcare provider and see if there's other solutions of toothpaste that you can acquire.
The initial procedure we performed was one we researched and came up with on our own. We decided we wanted to swab our teeth at the beginning of lab and smear that onto an agar plate in order to collect bacteria from our unbrushed teeth. Then, we would brush our teeth for 2 minutes, each using one of the previously mentioned toothpastes, and swab our teeth after brushing, hoping to see improvement from the previous plate. However, we did not get the results we had been hoping for. The results we concluded from our initial procedure were not at all what we had been expecting. We actually saw more growth on the plates after brushing than we did before brushing. If you look to the left of the slide, you will see two pictures. The one on the bottom has no growth present on the plate at all. The one on the top has more growth spots on it than the bottom plate. The bottom plate is actually the before plate, and the top one is the after plate, demonstrating the amount of growth we saw after versus before. Why did this happen? We believe it is likely because the saliva in the mouth naturally cleans and protects against most bacteria that we were looking for in the original before plates. Also, by brushing our teeth, we actually knocked the bad bacteria around, so it was able to be picked up by the after swabs and grow on the after plates. Our second, more successful method used to test our hypothesis of which toothpaste would clean teeth the best was the zone of inhibition method. This dates back to Dr. Alexander Fleming, the doctor who discovered penicillin. Fleming practiced poor aseptic technique when studying in the lab and discovered that molds could inhibit the growth of bacteria. This accidental method discovery has led to many tests today on new antibiotics, disinfectants, antiseptics, and even toothpaste. Yes, toothpaste. We felt that the zone of inhibition method would work best for our experiment because it would allow us to compare the range of each zone of different toothpastes to determine their effectiveness. Once we decided on this particular method after a failed previous test, we began following the steps of this test with the proper materials in order to produce more promising results than prior testing. Altogether, we had to do 3 different tests in order to determine the accuracy of our results. So we gathered 12 Mueller-Hinton agar plates from the refrigerator to use because this agar allows for the diffusion of chemicals from the inoculated discs. Next, we placed each toothpaste, Crest, Colgate, Young Living, and Aquafresh into their own individual petri dish and then placed the discs, using sterilized forceps, into the toothpaste. Then, we set a timer for 15 minutes to allow time for the discs to absorb the chemical agents. While the discs were inoculating, we utilized the spread plate technique by placing 3 drops of broth onto the center of the Mueller-Hinton plate with a sterile pipette. We then performed the spread plate technique using the sterilized spreader and broth placed on the agar plates. After spreading the plates with broth, the discs had been inoculated and were ready to be placed onto their respective plates. Each disc was placed in the center of the correct plate, and another timer was set for 10 minutes to ensure that the discs were stuck to the agar and not going to fall off when flipped to be placed in the incubator. Finally, after 10 minutes were up, the plates were placed into the incubator at 37.5 degrees centigrade to allow for optimum bacterial growth. If you look to the right of this slide, the top picture is showing the 12 Mueller-Hinton agar plates with their inoculated discs of toothpaste before being placed into the incubator. The bottom picture is showing the plates just after being placed into the incubator. Finally, after 2 days, the plates were then taken out of the incubator and placed into the refrigerator until we were able to come in and measure their growth. When measuring growth, we used a small ruler to measure the zone of inhibition by measuring from the edge of the disc to the nearest microbial growth. As mentioned when discussing the procedure, we used many different materials to complete this project. The 12 Mueller-Hinton auger plates were used because this auger allows for the diffusion of chemicals from the inoculated discs. We used Colgate, Aquafresh, Young Living, and Crest toothpaste. These toothpastes were chosen because each individual wanted to test out a toothpaste they use or had heard good things about. The 3 Petri dishes were used to hold the inoculating discs in the toothpaste. 12 sterile discs were inoculated with toothpaste and placed on the auger plates. An electric sterilizer was used to sterilize the forceps, spreader, and top of the bacteria broth tube. Sterile forceps were used to pick up and place the discs before and after inoculation. A timer was used to time the inoculating discs and the time before the auger was able to be flipped and placed into the incubator. Bacteria broth was spread onto the auger plates to grow bacteria. A sterile pipette was used to place the bacteria onto the auger plates. A spreader that had been soaked in ethanol was used to perform the spread plate technique with the broth and auger, and a ruler was used in the end to measure the zone of inhibition present on each plate. These labels are here as a reference and to show what you should be looking at in reference to the sodium fluoride concentrations of your toothpastes. If we were in person, we could demonstrate where you should be looking on your labels in order to find the sodium chloride percentages. However, since we are not in person, I will explain how to find this. First, you must understand that all labels are different, and depending on the toothpaste you buy, it may be an ingredient you have to look up. On the Aquafresh box, if you look on the back, where the drug facts section is located, you will find the sodium chloride concentration directly below that active ingredients heading. I have it circled on the box for reference. I have also circled the concentrations found on the Colgate box and the Crest box. Notice, Young Living does not have a percentage located on its tube. This is because Young Living is an essential oil-based toothpaste that uses thieves as its active ingredient. The ingredients for this toothpaste can be found by researching the internet. However, this particular toothpaste did not contain any sodium fluoride as it uses thieves as its active ingredient.
So with every experiment, there is also variables that can occur that can skew your results. So some of the variables in our experiment could be completely not sterile disc or forceps that were used that could cause some kind of bacteria to grow on those to skew the results. Another variable can be not the exact same amount of toothpaste is collected on each disc, so possibly some toothpaste fell off the disc, or it's not the exact precise amount, which can also then result in possibly different amounts of microbial growth if more or less toothpaste is used on the disc. And then another variable that we identified is the toothpaste can fall off the disc and onto the agar plate if not absorbed enough, so that could also result in being less toothpaste being absorbed on the disc, so then therefore more microbial growth is placed as well.
After comparing Test 1 and Test 2 of Crest, we saw a dramatic decline in the zone of inhibition of Test 2. In fact, Test 2 of Crest zone of inhibition was only 1 millimeter compared to Test 1 of Crest, which was 5 millimeters. After measuring the zone of inhibition of Test 1 of Aquafresh, it gave a promising sign towards being the best toothpaste because it measured at 5 millimeters. However, from previous tests with Crest, we knew that we needed more evidence before confidently saying our hypothesis was correct. The zone of inhibition of Test 2 of Aquafresh was measured at 4 millimeters, which is smaller than Test 1 of Aquafresh. However, it is still more consistent compared to the other brands of toothpaste. In Test 1 of Colgate, the zone of inhibition was the smallest zone out of all the tests in all the brands of toothpaste at 0.01 millimeters. This measurement was shocking because we thought that Colgate would have about the same effectiveness as Crest based on the fact that they both had about 0.24% of sodium fluoride. Test 2 of Colgate proved to be even worse than Test 1 of Colgate because the measured zone of inhibition was 0 millimeters. Test 1 of Young Living Thieves had a measured zone of inhibition of 1 millimeter, which again was not shocking when remembering the lack of sodium fluoride in the toothpaste. In fact, Test 2 of Young Living Thieves toothpaste was exactly the same as Test 1 with a zone of inhibition of 1 millimeter. In the final test, Test 3 of Crest, the zone of inhibition was measured at 3 millimeters, which was better than Test 2 of Crest, but still too inconsistent to state if Crest is the best brand of toothpaste. The final test, Test 3 of Aquafresh, the zone of inhibition helped prove that Aquafresh was the most consistently effective brand of toothpaste against bacteria because it measured at 5 millimeters, giving the overall average zone of inhibition 4.7 millimeters. The final test and best test for Colgate, Test 3, measured at 2 millimeters. Although there was a larger zone of inhibition in Test 3 of Colgate, when looking at all 3 tests of Colgate combined, it proved that it was not very effective against bacteria. Test 3 of Young Living Thieves was exactly the same as the first 2 tests with a zone of inhibition of 1 millimeter. After comparing all the brands of toothpaste in the tests that we performed, Aquafresh had the best overall zone of inhibition. This matches our hypothesis regarding the amount of fluoride and how it directly correlates to the effectiveness of controlling microbial growth.